Hey everybody, we're back again, week 3. Hope you've all been enjoying the process, and we definitely hope you've been doing your exercises along with us. So we're diving into lumbo-pelvic this week.
It's going to be a little bit longer this week, so y'all just bear with us. There was just so much stuff that we wanted to cover and make sure we did it justice, so y'all hang in there.
All right, so let's go over week 2 for just a second. Week 2 had planks. So if you've been doing planks, and if you're new to planks, then you might be having some soreness, and that's very normal. Your muscles will need some time to adapt to new exercise because they're doing something new, and new muscles are being strengthened where they haven't worked properly before. So if you're having some muscle soreness a couple of days after the exercise begins, that's very normal. If the soreness persists for 4 to 5 days in the same kind of region and it's really bothering you, that's not normal. Knowing the difference between normal muscle soreness and abnormal pain symptoms is important. So listen to your body very carefully. You have to be your own clinician here and understand that if you are having pain, definitely reach out to us. This is a no pain, no gain setting. So we want to make sure that you understand that muscle soreness is normal for a couple of days, maybe even 2 to 3 days after, but it's temporary and should diminish. And if you're having more severe pain, definitely email us.
And piggybacking on that, just as we're going through some of these things, last week's exercises, some of them were a little bit harder. But if you feel like you can't do it, don't try to be, Superman, Superwoman and push through things. If, like Kelly said, listen to your body. If it feels like it's a little bit too much for you, then just kind of sit it out and see. And then email us. We can send you modifications or other things you can try instead. Another question we actually got about last week was in regards to that transverse abdominis contraction. So, the cueing was like breathe in, breathe out, pulling your belly button back, releasing it 70%. So we had a question about knowing kind of where that 70% is. It's an arbitrary number. It's kind of just to give you an estimate. The whole idea is that you are releasing to kind of take some of these other muscles out of the equation. But usually the way I tell people is like, if you pull your belly, if you pull your belly button all the way back to your spine, and then you release it all the way, that's 0 to 100. Yes. So thinking about, your belly button is kind of the 0 point. Releasing it out, releasing it out, releasing it out. Almost if you were to push it out, that's 100%. Find that halfway in between there. It's going to take a little practice, but kind of find in the middle of that space, and that's your 50. And then release it a little bit more. So just knowing that you're going to pull it all the way back, and you're going to let it go about 2/3 of the way. It's an arbitrary number. There's no way to measure it. There's no way to really be like, oh, I'm definitely at 60% or 70%. You just kind of feel it out and kind of go from there. So I hope that helps a little bit. It's kind of just tuning into things and seeing how things are feeling. So thank y'all for sending us feedback and questions and stuff too.
Yes, send us more questions. We love that.
Yes. All right. So this week, we got a lot in store for y'all. We're going to be talking about the lumbar spine or the lower back and the pelvis. We're going to discuss some possible sources of low back pain. So what things can feed into low back pain, what causes it, what kind of leads up to it. We're also going to discuss a few ways to prevent injury to your lower back. So a lot of this is, we want to educate y'all so that y'all have awareness around this, but also so that y'all can prevent some of these things from happening. And prevent things from getting to kind of worst case scenario level. And then we're going to touch on the glutes and the hips, which are big players. Y'all are going to find out. And of course, we're going to go through some exercises again. So.
Okay, here we go. Let's look at this cylinder once more. As we are getting a little deeper now into lumbo-pelvic, we just want to come back and refresh what we've done. The diaphragm, remember, is the ceiling of our cylinder. And that's where we started week 1 with that diaphragmatic breathing to really set the foundation for the pressure system inside your abdomen. And the transverse abdominis we worked with last week, being able to connect in with that front part of your core, and the multifidus in the back, that spinal stabilizer, And then the pelvic floor, we're really going to get more in depth with on our final week 4. Here we go.
So, of course, we're going to start with anatomy. So we're going to show you a little bit of anatomy of the lumbar spine or the lower back. The glute muscles, we're going to look at the pelvis, sacrum, and coccyx. Y'all are going to learn what all of those words mean. I know we touched on the sacrum last week. And then we're also going to mention the pubic symphysis area. So, here we go.
Let's begin with the lumbar spine. We see low back pain a lot in the clinic. According to the World Health Organization, more than 80% of adults in America will have an episode of low back pain at some point in their lifetime. So this is a very good part of the body to be familiar with and have some knowledge around the anatomy and the function here. Let's look at the picture in the middle. The lumbar vertebrae are highlighted in red. There's 5 vertebrae or spinal bones in the lumbar spine. And you can see the bony protrusions on the left and the right side of the vertebrae. Those are the facet joints. The facet joints allow for a lot of rotation and side bending mobility to take place in your back. And when we look at the soft tissue attachments on the left side, the picture, you can see how intricate and how involved our soft tissue is in stabilizing our lumbar spine. So coming back to that multifidus muscle that we discussed last week, you can see that lines the vertebrae in the back. The pelvic floor provides that hammock support across the bottom. The transverse abdominis providing that wraparound support of the front, and the diaphragm at the roof. So you can see how all those muscular attachments provide that core of stability to our bony backbone.
So this is a little video. It's pretty cool, and it's just going to show you kind of when you move in certain directions, how your lumbar spine is actually moving. So it's going to show it from different angles as well. Let's see. And we always say motion is lotion. Moving is important for your joints. It keeps things lubricated. It keeps things healthy. But knowing that your spine can move in all these directions and it's totally safe and stable.
A lot of times when we see patients in the clinic, there is a lot of loss of range of motion in the whole spinal column. So as we get a little deeper into tonight, you'll understand some of the reasons why we would lose range of motion in the lumbar spine specifically.
Since we have reviewed the bony anatomy for the lumbar spine or the lower back, we're now going to move our way down into the pelvis and sacrum. So the pelvis is comprised of 2 halves. Each are called the ilium. As you move around towards the front, it's actually the pubic bones on either side. And then if you're looking on this picture on the left, right where it says coccyx and that little dotted line is, that's actually referring to something in the back of that picture. But right over where that little dotted line is called the pubic symphysis. We're going to touch on that a little bit later, but I just wanted to kind of point that out to y'all. We'll refer back to this when we discuss that a little bit more in detail later. But if you're looking at this picture on the left of the pelvis, you can see on either side there are the hip joints that come down into the upper legs. So now going over to the picture on the right, the sacrum, as we kind of mentioned last week and touched on, is this triangle-shaped bone at the end of your lower back or lumbar spine that connects the lower back to the pelvis, essentially. At the very end of that is what's called your coccyx or your tailbone, as y'all know it. And then, we're going to discuss, as we move through this week in this module, we're going to discuss the role of the glutes, a lot of dysfunctions that can exist not only in the lower back, but can originate from the pelvis region. So we wanted to give y'all an idea of kind of what the bony anatomy looks like here, just to give you kind of a bare bones, literally, breakdown of how things are looking. Another thing to note is, so that sacrum right there where it connects to the pelvis, those joints on either side are called the SI joints. I'm sure y'all have heard of this, or the sacroiliac joints. So just being aware of that location there.
Nobody has time for back pain. let's explore some of the possibilities of where your back pain could be coming from. As PTs, we're trained to look at things in a biomechanical perspective. So when we assess your body, we want to see how it's moving, what's not moving, what is not in alignment, and what movements can be improved. And when we look at it through this perspective, we see how back pain can be coming from the spine itself, or the sacroiliac joint, the SI joint. The feet, knees, hips can all feed into back pain. Also, poor movement habits, the day in and day out, sitting at the computer, moving in certain ways that are inefficient, moving in an unconscious movement pattern. All of those things can lead into back pain. And of course, our posture. So as our mothers told us when we were younger, sit up straight. It is a very important cue to use all through our lives to practice good postural habits, because the spinal column needs that good alignment to be able to function well.
So we know that you can experience back pain as a result of issues that are actually originating in your spine or lower back. But it's also important to, be aware that you can experience lower back pain as a result of dysfunction in other areas of the body. So you need to think of your body as one big chain reaction. Everything kind of works together in one way or the other. Each joint feeds into the other above and below it, and they work as a unit. So if you have breakdown in one area, that's going to cause problems up and down that chain typically. So for example, your lower back can also be affected by issues in your ankles, in your knees, and your hips, in addition to just having issues in the lower back itself. Generally speaking, you'll see more issues in the lower extremities or in the legs feeding up into this, but know that there's also issues, from the top down that can feed into back pain. For people who have any kind of scoliosis or curvature in their spines, whether that's in their neck, in their upper back, or in their lower back, that can for sure cause things to kind of kink out of whack. I love these pictures because it kind of shows you a good breakdown of how it puts undue stress on each segment below it if you have dysfunction in that area. So even on the picture on the right, it kind of shows if you have issues in that right shoulder, that's causing it to kind of sit a little bit lower. Inevitably that's going to cause some bending in the spine, which is going to put a lot of stress on that one part of the spine over and over as you're moving during the day. We're going to go into detail about this as well in a couple of slides when we talk about the glutes, but talking about pelvic asymmetry. If you have issues in the hips and pelvis, look how close that is to the lower back. So for sure, if something's off kilter there, that's going to put a lot of undue stress on the lower back muscles and on those joints as well. Some other things to look at in these pictures, the picture on the left and on the right kind of shows the same thing, but if you have a collapsed arch, that's going to collapse the arch of that foot, which is going to cause that knee to kind of come in a little bit more, which is going to cause more stress along that hip, pulling that pelvis down. And then that also stresses the lower back area on that side and on the opposite side, because one side is, being strained more and one side's having to over-engage to try to help the other side. So you can kind of see, you can kind of talk in circles, with these kind of things, because everything kind of has to function together as a unit and everything has to be pulling its weight and doing its role. And you can see in these pictures where if one of these things is a little bit off, how that's affecting everything up and down that chain.
Here we see a very common pattern for low back pain. We even have a name for it. It's called lower crossed syndrome. And many times people who sit in desks all day long, who sit in a chair for prolonged hours, will end up with this pattern. There is tightness in the lower back muscles, the erector spinae, and also tightness in the hip flexors at the front of the hip, that lower right corner, the iliopsoas. So the tightness in the lower back and the tightness in the hip flexors combines with weakness in other muscle groups, weak abdominals and weak glutes. And so when you get that weak core combined with tension in the neighboring muscles, you're really setting up the body's biomechanical pathways to fail, to not support the lumbar spine like they should. And then out of that, the muscle can become even more dysfunctional. It can go into a state of spasm where there is sudden twitching of a muscle or lockdown on a muscle. That's an involuntary contraction that can cause more pain. You can begin to have muscle atrophy in this type of pattern that goes on for too long. Muscle wasting and atrophy comes from not using a muscle or from compression on a nerve that innervates that muscle. And sometimes muscle atrophy can even come from pain inhibiting the use of that muscle, where the nervous system shuts it down. And then you can also have adaptive shortening of muscles, where the muscle length itself becomes shortened over a period of time. We see this very often in cases of poor posture. The slumped forward shoulders often produces shortened muscles in the pecs and the chest area, limiting the diaphragm movement. Injuries that cause pain can tend to make you maintain a certain posture of guarding with that pain, so that muscles in the abdominal region and the back can become tightened from guarding from the pain as well. So you can see in this picture, even with a simple pattern broken down into tight muscle groups and weak muscle groups, we can end up with a lot of different reasons for having pain out of these biomechanical dysfunctions.
Other sources of lower back pain can include ligament weakness, joint instability, and sacroiliac joint dysfunction, or SI joint dysfunction. So if you look at the pictures on the right, you'll see all of this white stuff. These white things are ligaments. They connect bone to bone. And essentially, ligaments are our first line of defense in regards to stability of a joint. So they allow range of motion at the joint, but they restrict excessive motion at that joint that they're connecting to. They cover all joints in our body. So every joint we have in our body has ligament attachments to provide that stability piece. So we can injure these ligaments, we can cause them to become weak, and that can lead to other secondary problems. So let's use the example of spraining your ankle. So when you sprain your ankle or roll your ankle, essentially what's happening is you are weakening those ligaments on the outside of the ankle. They're getting stretched out. The way I describe this in the clinic is almost like taking a big rubber band and overstretching it to the point where it doesn't recoil back or go back to how it was. So it's become a little bit more weakened. So spraining these ligaments can cause them to become weak. Sprains in these ligaments can be caused by trauma, if you've been in a car accident, any kind of repetitive poor posture puts a lot of stress on these ligaments and causes them to become more weakened, and therefore you kind of lose some of that support and that stability component. For sure, pregnancy, carrying a child, think about all of these structures that are kind of expanding and getting stretched out, as well as during childbirth. At best, these ligaments are getting weak. Some of them you're for sure spraining, during pregnancy and during childbirth as well. So you're losing some of that support in those joints. So that kind of can lead to instability. So repetitive sprains, a lot of weakness in that. It can cause instability. It can cause degeneration of that joint because of more stress in that area. But instability essentially is when that ligament or muscular system around that joint or that structure is unable to hold it in a neutral position while you're moving. So while you're moving around, again, ligaments provide that checkpoint. If you lose that support and that ligamentous stability there, you're going to get a lot of excessive movement there. Which can cause a lot of stress to the joint, a lot of stress to the muscular system around there, surrounding the joint as well. It can kind of just, again, trickle into this cycle of issues that can begin. So we had mentioned the sacroiliac joint earlier when we looked at the bony anatomy. So you can see on this bottom picture, this is the back view. So you can't even see the sacrum because it's covered in so many ligaments. But think about any injury that happens in this area here. If any of these ligaments get stretched out or weakened or injured or damaged, how much that is going to affect that joint system right there. This can cause a lot of issues, as far as lower back pain. It can cause some of these muscles in this area. We're going to talk about the glutes in a little while, the hip muscles to kind of break down too and start functioning in a more faulty manner. You lose that support system. You can also, there's debate on this in the PT community as far as how much mobility actually exists in that sacroiliac area. But Kelly and I come from the belief that there is mobility there. You know, think about when a woman carries a baby, how much that has to expand and how much space has to be created there. But if you have injury in the ligaments in this area as well, that can cause some of this pelvic and sacral area or these sacral bones to shift, and you can have malalignment issues, which can, again, trickle into other things as far as putting a lot of stress on certain muscles, putting more stress on some of these other joints when they're excessively moving. So just realizing that ligaments play a big role in things as well, and knowing that, you know, it's important to maintain that stability component and that strength. Going back to those core muscles, you know, our muscles and our core muscles are kind of our second line of defense. So when you have injury here, we really, really emphasize the strengthening piece to give it a backup support system. So maintaining good strength is going to help prevent, you know, any injury or any issues you have here from creating bigger problems down the road.
I'm sure everyone has heard of disc issues when it comes to the spine. The intervertebral disc acts as a cushion between the vertebrae at every segment of the spine. We need the disc to provide shock absorption and also to provide nutrition to our spine. So when we look at the normal disc fibers, you can see how there's different variation in the layers of the disc. Starting with the outer ring, that's called the annulus. The outer annulus acts as a ligament. So it actually serves the purpose of stabilizing and supporting one bone on top of the other, attaching the spinal column to itself. There can be pathology or damage occurring in this annulus that can make the spine unstable from one segment to the next. But there can also be a loss of the gel-like material on the inside of the disc. You see that little ring. A lot of analogies are made clinically to this inside jelly material. That is called the nucleus of the disc. And that material is very viscous and full of water. This water-filled material provides a lot of the shock absorption. And as we age, that nucleus that's filled with water begins to dry out. So we do have natural degenerative change associated just with aging whenever we look at the disc. It's one of the reasons why we recommend hydrating so much to patients that are suffering from low back pain, especially when there is disc pathology, because we really want that disc to be plumped up with water to be healthy. Now, when the disc does get affected by disease, wear and tear, or any type of pathology, it can lead to less room for the nerves to exit the spine. So you can see on this picture on the left, at the top of the lumbar spine, the normal disc is illustrated. It's all within its proper space where it should be. And then below that, you see a picture of a degenerated disc. So this is what our spines start to look like. They show some of those changes in our 30s and 40s. And then a bulging disc has a little bit more pathology going on because it's starting to bulge out into the space where it should no longer be. It occupies the space in this picture where the nerve root canal is. And so when it bulges out and touches a nerve root, then you can imagine that compression on a nerve is going to hurt. And then you see the illustration of a herniated disc. So disc herniation is a common term in society. The disc herniation actually means that that water content is protruding out of the ligament tissue that holds in the jelly. So that nucleus can protrude out into the space even further into where the nerve passes and cause more pain and more tissue trauma. And then we see below that a thinning disc. That is happening a lot of times in degenerative disease. And that's very commonly picked up on X-ray imaging. And you can also have trauma due to falls, rotation of the spine, other things that can tear the annulus layer and cause a herniation through injury. So when we look at everything that can go wrong with a disc, there are some age-related changes, some disease-related changes, and then also some changes that are due just to trauma or injury.
At the bottom of the picture on the left, you can also see the disc degeneration due to osteophyte formation. So those are bone spurs. And many times bone spurs will show up whenever there has been instability in the spine. So bone spurs come through friction. And when there is too much motion occurring between a segment, the bony tissue is going to reinforce itself and get thickened and form those osteophytes or bone spurs. So this is another reason, looking at the picture of the bottom of that lumbar spine, that you really want to take care to maintain your muscle strength and your core function, because having strong core and abdominal function is going to let you prevent the formation of bone spurs via instability there as you age.
There are degenerative changes that can also occur in the spine that can cause lower back pain or pain really in any part of the spine. If we look at the picture to the left, this is a normal spinal segment. So you'll see that vertebrae at the top, the nice bony structure with the parts that extend out towards the back. You have the disc right underneath it, and then another vertebrae with the bony structures also extending out to the back. So I want you to take notice of where it says spinal cord there, where it's labeled. That is an opening. That is a space right there where the nerves exit from the spine. So our spinal cord is nice and enclosed within the bony structure of our spine, behind this big vertebral body. And then at each level, you actually have nerve roots and nerves that are exiting at each part of the spine to innervate and go to specific muscle groups in that area of the body. Now, degeneratively speaking, we're going to talk about two major things. We're going to talk about spinal stenosis and osteoarthritis. So spinal stenosis is any narrowing between the vertebrae. So the vertebrae are those big structures right there on the left side picture. So what ends up happening is that spinal canal, which contains the nerve roots and the spinal cord, becomes compressed. So that's going to cause a lot of increased pressure on the cord or on the nerves exiting the spine at that level. You can kind of see the pictures on the right as well. So this is a view if you're looking over the top. So they pulled out one segment of the spine, you're looking over the top of it. So you're looking down on that disc space. And then as you move towards the right in the picture, you see the nerves coming out from the spinal cord in the center, and then all your bony structures as part of that vertebrae as well. So the picture on the left is normal. The picture on the right is showing spinal stenosis. So degenerative changes occurring there. There's some bone spurring. So anything that's encroaching in that space is going to cause, some compression and some pressure on those nerves and that spinal cord. Generally speaking, spinal stenosis is usually from wear and tear in the spine that's related to osteoarthritis. It can be very mild and not cause any issues, or it can actually be pretty severe and cause some major problems. So it can be caused as well from, like we mentioned, bone spurs, herniated disc can cause spinal stenosis, any injury to this area or trauma to this area, tumors, anything like that. Essentially anything that's encroaching in that space. Now, osteoarthritis is degeneration of the cartilage between the joint surfaces of the spine. So you see in the back of those segments, you have that big vertebral body, and when you come out, you have that facet joint like Kelly had mentioned previously. So you can get degeneration of the cartilage space there. It's wear and tear of the entire joint. So the cartilage, the lining of that joint, ligaments in that area, bones, it's kind of just general degeneration. Sometimes as a result of some of this breakdown, you develop those bone spurs. That can end up putting pressure on those nerves. So again, back to spinal stenosis. So just knowing that there's levels of degeneration that are normal, that are going to occur during our lifetime, that can cause some problems here as well as pain. So it's important to stay moving, it's important to stay exercising, maintaining good mobility of the joints, maintaining good muscle strength. All of those things can not necessarily prevent these, sometimes they can prevent them, but it can prevent it from becoming a worst case scenario. So let's talk about what is considered quote unquote normal. So we kind of reviewed in the last slide what a normal spinal segment looks like. So we have that picture right there. But I want to talk about this study. The study is so great. The authors of the study took 33 articles in which they were reporting findings of certain imaging. So imaging includes like X-ray, CT scan, MRI. I think in this case, they looked at CT scans and MRI specifically. But these authors pulled all of these articles, which had these CT scans and MRI results for over 3,110 people that had zero symptoms. So they had no pain. And what they found was that in these findings, in these images, you know, CT scans and MRIs, that degeneration of the spine is present in high proportions of individuals that have no pain and no symptoms, and that it increases with age. So, you know, they're basically saying many of these degenerative features that we're seeing on these images are likely just part of normal aging processes. They're not necessarily associated with pain. So look at some of these numbers. These numbers are crazy. These results kind of speak for themselves. They found that 37% of 20-year-olds had disc degeneration. 30% had disc bulging. And look, as we go up in age, how these numbers climb up. 80% of 50-year-olds had degeneration in the disc. 60% had disc bulging. And saying going up, 80 years old, 96% had disc degeneration. 84% of 80-year-olds had disc bulging. None of these people had pain, had symptoms, but they found all of these degenerative changes in the spine. So essentially what they're saying is kind of take this with a grain of salt. If you're experiencing pain and you go get a scan done, you know, and the doctor's telling you, oh, well, you have disc bulging here, here, and here, you have degeneration here, here, and here, it comes off very scary because it seems like something's wrong. But know that this is normal and that those things aren't necessarily associated with your pain symptoms or with the other symptoms that you're experiencing. Sometimes they are, but, you know, being aware that each of this has to be taken with a grain of salt. You need to, you know, these need to be interpreted in the context of what else is going on in your body, what other limitations you're experiencing. So when someone comes into us in the clinic and they're like, oh, well, I had an MRI that had disc bulging, or I had a ton of disc degeneration, we're like, okay, we kind of just make a note of that, but we're putting that off to the side because chances are there's other things that are actually feeding into this problem.
Now that we know more of the data, we want to emphasize reasons why a person should seek the help of a physical therapist. So whenever you've had an episode of low back pain, your muscle firing becomes altered. That means that the coordination between the muscles changes due to the pain process. Certain muscles become inhibited or weakened, and other muscles become tense or overactive. And so what you end up with is an imbalance between weak and tense muscles where the brain is no longer patterning and coordinating those muscles very well. Core muscles do become weak with low back pain, and it's because of how those muscles are being recruited. So through the coordination changes in proper motor control, the core muscles can get inhibited. And that word just means that they are not firing as often and their coordination and timing gets thrown off. So the core definitely gets affected. The multifidus muscle, as we've spoken of before, does not recover all on its own. So many times in the clinic, we are retraining that multifidus muscle group to have the proper stability from segment to segment, especially in the thoracolumbar area, your low back, in order to help stabilize the segments properly to restore good biomechanical control in the body. And then there's the delay in the transverse abdominis contraction. That transverse abdominis that we've talked about a good bit that wraps around the front and provides that frontal core stability is delayed in working in order to help you lift and squat and carry loads properly. So remember, whenever Christina was talking about the transverse abdominis and your multifidus are going to co-contract together. They're friends to stabilize across the spine. And when their contraction is delayed, you're not beginning with that foundational core control that you need in order to use your arms and your legs properly for functional activities.
Okay, guys, we haven't received any questions yet. So if you have any in mind, please send them to us. We'll just keep on rolling since we have a lot of content to cover tonight.
Let's talk about the pain process between the mind and the body. Pain is perceived in your brain. So your brain picks up the signal from the body via the nerve tissue. The nervous system is always sensing and receiving signals from your tissues in your body and sending that to your brain. That is the feedback system. And then your brain is changing the output to the muscle based on what it is sensing. So in this feedback loop, our nervous system changes, and it changes our muscle control whenever there is pain involved. So if we're under stress, particularly, this stress is going to affect our nervous system. Muscle tension, muscle guarding, that feeds into the fight or flight syndrome. So throughout our graphic here, you can see how all of this is what we call the vicious cycle of pain. Increased stress leads to increased pain, leads to increased muscle tension, and then your nervous system increases its fight or flight, which in turn decreases your circulation to the muscle tissues. Chemical toxins will sit around in those muscle tissues because of poor blood flow to them. And that in turn increases the pain, which increases the stress. This is why we have a vicious cycle here, because this loop can repeat itself and actually intensify the pain process, especially when your mind and body are under stress or fight or flight. Fight or flight is the stress reaction. That is the human response to running away from the woolly mammoth. That is hardwired into us over all of these years of evolution where we've been hardwired to flee from pain. Imagine yourself walking down the street and you step on a sharp nail that pierces your shoe and it contacts your foot. You're going to immediately withdraw your foot because of that pain. That reaction is a reflex, and that is part of this pain, fight, or flight response system. That kind of response is meant to protect us. But whenever pain becomes chronic, our brains and bodies are running this feedback loop that is no longer effective. The nail is not sticking in our foot all day, but the responsiveness of our nervous system is running in an ineffective mechanism. Stress feeds into that, muscle tension and guarding feeds into that, and then you get that chemical process escalating the pain. That's the vicious cycle.
Let's talk about loads on the spine, specifically loads on that intervertebral disc in the lower back. So we thought it was important to include this slide to educate y'all and to bring some awareness around the amount of load that we put and the amount of stress that we put through our discs throughout the day. And some of this, I'm sure some of you weren't aware of, but they've done lots of research on this. We learned this in PT school, and we teach this to our patients too. So did you know that you actually have the greatest amount of load on your spinal disc when you are sitting more in an unsupported position versus supported? So sitting puts more stress on the disc than actually standing up does, even though it would seem to be the other way around. But if you look at this picture here, you can see starting on the left, The loads are the least when you're lying on your back, and they start to increase as you stand up, and then you slump, and then you're holding some weight, and then you go to sitting, and then you sit in a slumped position, and then you sit with weight. So the highest amount of compression load on that disc is when you are sitting with an unsupported back in a slouched posture and you are holding some type of weight. But even just sitting supported, look at how much force is going through your spine. So this is something that we want you to keep in mind as far as how our positioning or our postures are affecting our spine throughout the day during just regular activities. Think about how often you're sitting or even standing, you know, and thinking about the forces going through your spine. This is especially important to consider and remember for those of you that are primarily sitting during the day at work or have desk jobs. This kind of re-emphasizes why it's so important to get up and move around during the day, so that you redistribute those forces and shift the amount of force going through your disc, and kind of get some mobility going back there. So something just to be aware of, something to think about. You know, seated posture, we always emphasize making sure you're sitting up nice and straight, nice and tall. Lean up towards the back of your chair. There's, you know, reasons for that. There's a lot of compression when you're slouching forward at the end of the day on your computer, you know, looking like, I don't even know, like a sloth, essentially. But just having awareness around how you're holding yourself up is actually putting more stress through your back.
This made us laugh. We kind of just had to include this in there. So we hope y'all are doing okay. We know this is a lot of information to take in. Feel free to send questions if there's anything that's confusing or unclear, and we're just going to keep on rolling.
This little person here doing a one-arm push-up wants to give you some advice for how to take care of your back and to avoid low back pain and hopefully avoid the chances of you having a spine transplant one day. So you want to maintain good core and pelvic floor function. This really is that foundational key for keeping your back healthy. This includes good hip, pelvic, gluteal strength, and firing patterns. That's that coordination and strength that we really work on as physical therapy goals in order to recover full function. You want to avoid prolonged postures. So in our modern society, this includes not looking down at your cell phone for prolonged periods of time, because that will strain your spinal position, strain your muscles and your posture. You want to be able to break up your driving time if you're a commuter by taking little stretches, relaxing your muscles, relaxing your shoulders, because even driving in the car for a long time is a prolonged posture that can be a negative factor for our back. And sitting at the computer for long periods of time. So if you are an office worker, you have a desk job, you definitely want to be getting up and stretching every 45 minutes to an hour. We've instructed many of our patients to set alarms or reminders on their phone or their computer so that they get up out of the chair and take a stretch break, take a walk around. Changing your body position throughout the day is one of the #1 ways that you can avoid that prolonged posture that is a very negative thing for your spine over time. Watching your work ergonomics. Again, this is about looking at your workspace. If it's a desk and computer situation, you want to have good ergonomics, good positioning so that your spine can be in its neutral curvature and not slumped, not in poor posture all day. And that goes for a standing desk too. You don't want to lock out your muscles in standing in a tense position for too long, but you want to remain flexible and changing posture, shifting weight between your legs so that even a standing work position is not prolonged for too long of a time. Your lifting mechanics are important. We do a lot of training on this with patients in order to use your core and recruit your abs in order to lift. There's a lot of improper lifting out there, even among the fitness population. So you want to be able to engage your core. Some of the things you're learning in this class are helping you to engage your core muscles better, and that will give you a better foundation for lifting. Staying active, it's the same rule that we've always heard: move it or lose it. Your muscles will atrophy with aging if you do not move them. So a sedentary lifestyle is very harmful on our health. just knowing this general rule of thumb, getting up, getting out, getting moving, really key to a healthy lifestyle. And then always see a PT for more specific recommendations, especially if you're hitting that pain cycle. Over 3 months is that chronic pain. When we see patients that have been dealing with pain for more than 3 months, it's a lot harder recovery process in general, because it's already thrown into the mix some of those more complicated factors with pain.
So now we're going to talk about the gluteal muscles. So they're important to mention because the glutes are also considered to be part of the core in a lot of the literature and research that's out there. This is due to their relationship to the pelvis and their role in power generation. So the glutes actually provide stability to the pelvis during movement and in static positions. So they're active with nearly all activities that we're doing during the day. If we're just standing still, if we're standing up from a seated position, if we're sitting down from a standing position, walking, climbing stairs, squatting down, running. They also play a role in flexion and extension of the trunk. So if you look here, there's 3 sets of glute muscles. So you have the big gluteus maximus, which is basically your big butt cheek muscles. You have your gluteus medius and your gluteus minimus. So we're going to talk about some of these in the next slide as well. But generally speaking, know that the glute max, those big muscles at the top, are a big player in stability. They attach on the sacrum and the coccyx tailbone area, and they approximate the 2 surfaces of the pelvis and the sacrum as well. So they're giving this area a lot of support. Poor firing of that muscle can lead to altered walking mechanics. So it ends up putting more stress on other structures if this muscle isn't functioning the way it's supposed to. So we briefly mentioned the role of the gluteus maximus in support and stability of the pelvis. We're going to talk a little bit more in detail about the gluteus medius muscle and the gluteus minimus. Generally because we tend to see more weakness in these areas, and these play a little bit of a bigger role as far as like your walking patterns and day-to-day activities. So their role or function is to keep your pelvis in a neutral position when you're standing on one leg. So you may be asking yourself, like, when am I ever really standing on one leg? But you're actually doing it a lot during the day. Think about your gait cycle and when you're walking. So you're actually standing on one leg for very brief periods of time as you're swinging that other leg through. Also thinking about when you're climbing stairs, you're bearing weight just on one side as well. So this glute med and min, what we call them for short, function to keep that pelvis in that neutral position. So if we look at the picture on the left, they're labeled as hip abductors. That is what they do. They abduct the hip. But the picture on the left frame, all the way to the left, shows normal function of these glute muscles. So if they are firing as they should, when you're walking and moving around, that pelvis is staying neutral or in a level position. If we look at that same picture on the left, but on the right side of it, it shows weakness of these muscles and what happens. So if you have weakness in the left glutes, it's actually going to cause the right side of that pelvis to drop. You don't have that support maintaining it in that leveled position. Same thing the picture on the right kind of depicts. So weakness on one side actually causes the pelvis to drop on the opposite side. So these muscles are pretty important. Think about, you know, if you're walking around and you have a lot of weakness in these muscle groups and you're getting that repetitive dropping of the pelvis, it's causing a little bit of a side bend in the lower back. So the picture all the way to the right, so the right frame all the way to the right where it shows the weakness of the glute muscles, you can see it in that back. It's causing a little bit of side bending there. So think about when you have that weakness and you're getting constant stress in that area of the lower back over and over when you're walking, when you're going to stand up, when you're climbing stairs, when you're doing any type of activities, and how that can irritate things there. That's also going to put a lot of stress on the hips and trickle down into the knees. You know, thinking all the way back to one of those first slides when we were talking about things that can cause lower back pain, you know, for sure, weakness in the glutes is a big factor. In the clinic, we always address this. We always check for this because we know this feeds into this and can cause a lot of pain, you know, secondary issues because of weakness in these areas. It puts a lot of stress on these surrounding structures. So having strong glutes is just as important as having some of those strong core muscles that we mentioned last week. Maintaining good strength in these is going to allow you to move in an optimal way and minimize the risk for developing pain patterns.
Our glute strength is very important to maintaining lower back function. So whenever we have chronic back pain, our glute muscles are inhibited, they're turned off, and they get weaker. And then the hamstrings are going to overcompensate for those weak glutes. The hamstrings are the next in the movement chain. And we often see tight and tense hamstrings that lack the flexibility to allow the lumbopelvic complex to move properly. Whenever you strengthen those glutes, it breaks that improper muscle chain of firing, and those hamstrings can take a load off because the glutes strengthen and do their job.
So strong glutes are essentially the helpers that unload your spine and really help support your lower back. Whenever the glutes are weak, your back can tend to overextend or overarch during activities. So those tight hamstrings lead into overarching sometimes, and it's missing that strong link of the glutes in that whole chain. This can lead to increased tension and tightness in the larger muscles that run up and down the back of the spine on the left and the right, the spinal extensor muscles. And so whenever those are overactivated in your lumbar spine, those tight muscles are a lot of times what will bring a patient in to see us, because they're saying, oh, my aching back, it hurts, my back muscles are so tight, I don't know how they're this tight. But whenever we get down to the bottom of what's occurring in the biomechanics, the glutes are often weak and the hamstrings are tight. And it's really throwing off those low back muscles in the way that they time and pattern and coordinate with everything, overworking themselves, which adds to more compression through the spine. And going back to that slide visually, if you can imagine that increased compressive force through your spine can lead to more disc herniation issues down the road, or more risk for injury of your back. Osteophytes, bone spurs, those kinds of things can come from increased compression on the spine. So this whole slide really demonstrates all those reasons why glutes are so important for them to be functioning fully and strong. And we included a little pro tip here as a summary for approach to your life. Don't sit for too long at a time. If you work at a desk, get up and do some squats. Get up and walk around the office. Change your position. Get out of the chair. We don't recommend that you sit any time over 45 minutes. So, and sometimes I'm telling patients, get up every 30 minutes if you need to. So if you're sitting an hour, you definitely want to move and change positions. Don't let yourself sit that long through the day. Because sitting on your glutes that long is going to continue to weaken and inhibit them and cause more problems.
So it is exercise time. Everyone can get, is it exercise time? Yes, it is. Everyone can get out their yoga mats, their pillows. If you're sitting in a firm chair, you can also stay in that for this next one. If you can't lie flat on your back, for sure, grab a couple of pillows. But we're gonna give everyone a second to get situated, and then we're gonna show you the setup for the first exercise. Okay, so the first exercise we're gonna do is called a glute set. So we're going to just learn how to engage our gluteal muscles. The video that we have is going to demonstrate it like this first picture we have on the top left, on the belly. And that's mainly just for y'all to be able to see what we're doing, how you're doing it, how you should be doing it. But you can really perform this in 3 positions. You can do it on your stomach, you can do it on your back, like this picture of Kelly here with your knees bent, or you can do it in a seated position. So for those of you that may not be able to lie flat on your back, if you're pregnant, you can probably just try this sitting down. But as we go through it, feel free to kind of change positions and see what it feels like. It may feel a little bit better for you to do it on your stomach at first, or or try it on your back. This is something you can also do just like sitting throughout the day at your desk, in the car, things like that. So for those of you that can kind of change positions, feel free to kind of switch it up as we're letting the video run and walking you through it, and see what feels most comfortable for you and your body and kind of go with that. So hopefully y'all have gotten situated and y'all can still hear us and are ready to go.
To demonstrate the glute squeeze, we want to have you lying on top of the pillow so that your pelvis and low back are fully supported. And go ahead and just relax everything in your body with a deep breath. Starting from a place of muscle relaxation is the best way to begin. So you're going to squeeze your glute muscles together, squeezing left and right butt cheeks, very consciously, very isolated. You want to watch out for squeezing your hamstrings here. Yeah, so you can feel if the hamstrings are contracting, you can reach back there and touch your hamstring muscle and make sure that it is staying as quiet as possible. It's a very common compensation during this exercise to contract your hamstrings, but we don't want to recruit there. We only want to recruit the glute muscles. So as you squeeze, you're going to hold for 2 seconds and you're going to relax. And you're just going to repeat the 2-second hold and relax. And as you go through the repetition, you are going to make sure that all your other muscles are staying quiet and that you're really isolating the 2-second glute hold. Make sure you're not holding your breath here. And if you want to, as you get into the rhythm, you can exhale on the squeeze. Inhale on the relax, and exhale on the squeeze.
All right, everyone can stay situated on the yoga mat. If you're sitting, for sure, make your way down. Make your way down to the ground, stack up a few pillows, and we're gonna talk you through the setup of this one.
Okay, so just lie on your back, relax your back, bend your knees. You don't want to have your heels too close to your seat, so you just want to have them bent comfortably. As you try out this exercise, you can always adjust the bend in your knees by moving your feet either closer or a little farther away.
All right, y'all ready? This next exercise is called a bridge. This exercise is going to focus on engaging those glute muscles a little bit more than those glute squeezes did, as well as engaging the core. So you're going to lie comfortably on your back, head supported, knees bent, hands by your side. And I want you to slowly try to lift your pelvis up off the ground, straight up towards the ceiling, and then slowly come back down. While you're doing this, you should feel those butt muscles squeezing or activating. And again, you want to make sure that those hamstring muscles are not firing. So you should not be feeling any burning in this area, any muscle cramping. If you are, it's probably because those hamstrings are trying to compensate for those glute muscles. So as with all these exercises, you want to make sure you're doing this in a comfortable, pain-free motion. If you're starting to feel pain when you get to a certain point in that motion, then keep it small. Work in that range that you feel comfortable with. And that's okay if you're just able to slightly get your glutes up off the ground and that's all you can tolerate. Just continue to work in that motion. If you still feel a lot in your hamstrings, you can also try bending your knees back a little bit more. Good. And then lifting up again. So making sure those glutes are squeezing and firing as you're lifting up. Keeping everything nice and comfortable. We wanted to make sure and talk about sciatica since it's a term that's so commonly kind of thrown out there. I'm sure most, if not all of you, have heard the term sciatica or know somebody who's had sciatica, or maybe even you've experienced it yourself. So we want to give you some kind of general background on it and things that can cause sciatica. So
It's important first to know that sciatica is not a diagnosis. It's basically, me and Kelly kind of call it a trash can term, because it's basically just a word that insinuates that there's irritation of that sciatic nerve somewhere along its path. It gives no information as to what's causing it, or what the actual problem is. It's just saying, hey, this nerve is really irritated. So the sciatic nerve is a nerve that originates in the lower segments of the lumbar spine and the upper segments of the sacrum area. So it kind of originates from the spine in that lower area and exits out the back of the pelvis and runs down the back of the leg, and eventually it splits into other nerves near the knee and continues on down into the lower leg and foot. The sciatic nerve is the largest nerve in the body. Some things that are typical of quote unquote sciatica or sciatic nerve irritation are that you're typically going to have pain only on one side. It's not common to have pain on both sides. If that's what you're experiencing, you're probably experiencing some other type of issue. Generally, people will report pain down the buttocks area into the glute or down the back of the leg. Some people do have lower back pain with it and some don't. But most of the symptoms people describe are just kind of a general ache, some sharp pain. Sometimes they'll have weakness down the distribution of that nerve. Sometimes they'll get like numbness and tingling and nerve pain, burning. So just to get you a general idea, when you hear the word sciatica too, don't be afraid and think that it's this huge beast. It really just means that there's irritation somewhere along that nerve path, and we have to figure out where it's coming from.
Let's look at sciatica a little more closely. So where does it come from? Looking at the lumbar spine, you can see in the picture on the left, all of the lumbar nerve roots branch out on the left and right sides of the lower back, and the lower lumbar nerve roots come together to form the sciatic nerve that runs down the back of the leg. So you have those nerve roots very closely approximated to the disc. And on the picture on the right, you can see an illustration of a disc herniation between the L4 and L5 vertebrae. That's a very common level to have a disc herniation. And so that red bulging tissue, that's where the damage is at in the disc, and that compresses the nerve root that is exiting the spine right there. So in this case, the nerve root of L5 is getting compressed. And that can send pain signals, that can certainly stir up inflammation and cause some nerve symptoms, the burning, the irritability, and the pain cycle that comes along with sciatica. So sciatica can be caused initially from disc herniation in the lumbar spine, or the compression of that nerve root that is associated with it. And the compression of the nerve root can also happen from spinal degeneration, like we've talked about earlier. The spine itself can narrow, and the bony changes can compress those nerve roots that lead into the sciatic nerve. And then, of course, you can get disturbance of the sciatic nerve anywhere along the course that it runs in the body. Because the sciatic nerve is so large and so long, it has a long pathway down the larger muscles of the leg. The hamstrings can entrap it. It can cause sciatic nerve irritation. The myofascial tissue that covers around the nerve all the way down its path can become tense and tight and inflamed. And so sometimes we see those issues occurring along the highway that it runs in versus just back at the lumbar spine where the disc issues can arise.
We know that sciatica can originate from issues in the lower back itself, but as Kelly mentioned in the previous slide, sciatica can also be from disturbance of the nerve anywhere along the course that it runs. It originates in the lower back, but it is a long and it is a very big muscle that runs down through a lot of muscle groups. So there is a lot of areas where it can get entrapped or compressed. So I included the picture from the last slide at the bottom here, just to give you another reminder and visual. Look at that lower pelvic cavity. So the sciatic nerve originates from the L4 nerve root, and it also originates from those nerves at the levels below. They all converge to kind of dive down and form that big sciatic nerve as it exits the pelvic area. But having any kind of pressure or issues there, along the hips and the pelvis. Think about the stresses going through some of those structures. Sometimes that can, cause inflammation around the sciatic nerve, which causes pressure and compression and leads to some of those symptoms. Also thinking about pregnancy, carrying a fetus, especially as that fetus starts to develop and get a little bit bigger, thinking about the weight of that baby sitting on those structures in the pelvic area and sitting on those nerves, and all the stress it causes in the lower back as well. As the sciatic nerve exits the lower back and pelvic area, it dives down under the glute muscles. So clinically, we'll see this as well, where someone will come in with pain directly in the buttocks. Sometimes it's glute muscles, sometimes it's piriformis muscle, which we're going to talk about in a second. But sometimes tightness in those glute muscles, just from faulty patterns, can compress on that sciatic nerve and cause issues there. Weakness in the glutes as well. Think back to the slide a couple minutes ago where we talked about the important role of the glute med and min in maintaining that pelvic in a neutral position. Think about if you have weakness there and it's just dropping over and over on one side, and thinking about that nerve kind of gliding through there and getting a lot of stress and, irritation around it as well. That can also cause those symptoms. It can also get trapped underneath a muscle called the piriformis muscle. I'm sure some of you have heard of something called piriformis syndrome, which is also kind of a trash can term, but essentially it means that that sciatic nerve is getting compressed or trapped underneath a tight piriformis muscle. So a piriformis muscle is kind of like this ropey muscle that goes from the sacrum all the way out to the hip. It tends to get very tight, especially if you have weakness in your glutes, issues in the lower back. This muscle just kind of loves to hold on. So it's not uncommon that, again, people come into the clinic and they're like, I have pain in my butt and I have some pain and numbness and tingling down my leg. This muscle tends to be tight a lot of times. And again, looking at that second picture there, you can see that sciatic nerve runs directly underneath that piriformis muscle. So imagine if it's tight, that nerve is getting direct pressure on it and direct force. That's really going to make it pretty unhappy with you and cause pain and cause all these crazy symptoms as well. So as we kind of continue to move down, you can see in that top picture, the hamstring muscles are actually attaching on the bottom of the pelvis on the right side of that picture. So as they exit through the glutes, they come down and dive underneath those hamstring muscles as well, or the sciatic nerve dives underneath those hamstring muscles as well. Hamstring muscles are another group of muscles that love to get tight, especially when you have issues in the lower back, weakness of the glutes. They like to jump in and kind of overwork. But again, that's going to cause problems and that's going to cause compression in the sciatic nerve. So we just hope that, kind of educating y'all on some of these things gives you a little bit more awareness. It gives you a little bit better idea of what's going on in your body if you're experiencing some of these things. And it also almost makes it less scary to know that, okay, maybe it's just that I have some tightness. Maybe it's just that I have some weakness. These are things that we can address. But that's why we also keep emphasizing the importance of staying moving, maintaining good range of motion, maintaining good mobility of the muscle, maintaining good strength, because all these things play a role. The body's really interesting and works together really well, but like we had mentioned before, if there's a kink in the chain, it's going to cause some issues around that area as well. So we hope this kind of gives you a little bit clearer understanding about sciatica.
So this next exercise is called a cat-cow. So this will be the last one, but everyone get those yoga mats back out. You won't need a pillow. And we want you to get in an all fours position. So as you're kind of getting situated, we want to make sure that you're getting squared up properly. So as you're getting into all fours, we want to make sure you're stacking yourself correctly. So wrists and elbows should be directly under your shoulders. Your knees should be directly under your hips and make sure they're spaced out under your hips as well. And you should get your spine in a neutral position. Sometimes this is kind of hard to feel if you're, quite in the correct posture. If you're next to a mirror or something like that, get in front of that to give you some feedback and just make sure. But see if you can kind of feel out where that kind of stacked posture is at and get yourself into that position.
For performing cat-cow, we're going to start in neutral spine. Neutral spine is a position where you are not tucked or arched at your lower back, but you want to think about your spine as a straight line. So in order to start moving with cat-cow, we're going to use your breath. We're going to move your head up to look up and your tailbone up at the same time, and this is inhaling. And as you exhale, you're going to tuck your head down and your tailbone down, squeezing in your belly. You're going to inhale, head up, tailbone up, and exhale, head down, tailbone down, squeezing in your belly to exhale. Inhale, head up, tailbone up. Exhale, head down, tailbone down. So you can see the large amount of spinal motion that you're rounding and arching through. This is why we're performing this for your lumbar mobility. It also helps with thoracic mobility, chest expansion, transverse ab recruitment. Head up, tailbone up, inhale. Head down, tailbone down, crunching to exhale, actively using those transverse abs. As you go through this movement, you want to sense how your body feels. You don't want to go into a painful range of motion. So if you feel pain, stop. Find what works for you in a gentle manner and let your breath rhythm guide your body motion. So when you get the coordination of this, you're working all these parts together with your breathing. It takes a lot of conscious effort focusing in on the body and how it feels. That will be your best guide.
Okay, everybody. Hey. So we had a little bit of tech issue tonight with some attendees not being able to join. So we know that we might have missed out on some questions. If you do have questions, definitely email us. So if you're watching this recorded version this week and you're catching up, just shoot us an email if a question arises. We always love to make it as interactive as possible and to ensure that you're getting the most out of this process. And then for next week, we're doing the pelvic floor.
Yay! Driving all the way down to the bottom.
Yes, we can't wait. Thanks for sticking it out with us. We know tonight was long. It was a lot of relevant info, we hope. So again, just contact us if you need a thing.
Y'all have a good Halloween.
Bye.
Bye.